All right, good afternoon. This speech today is my proposition for this speech today is that the FDA should implement a moratorium on the use of psychotropic medications for children and adolescents. So just imagine millions of children taking medications that are designed to treat mental health and emotional issues, but is shortening their life expectancy and causing premature deaths. Uh, Today, I'm going to present to you, the audience, the risk associated with psychotropic medications and how we can protect children moving forward. First, we're going to discuss the impact that this has on adults. We're going to talk about how these same medications impact children. And then we're going to talk about how to improve efficacy and the safety on these medications. So, first, let's talk about the impact that these psychotropic medications have on adults with fully developed brains and bodies. There are so many concerns that come from these medications in adults that, according to AIR, many of these psychotropic medications taken by adults can reduce life expectancy anywhere from 10 to 20 years, and these same side effects impact children. These drugs also can cause premature death in adults as well because of these side effects. These drugs are effective in reducing patient symptoms, um, those people diagnosed with mental health issues. And one of the major side effects from many of these psychotropic medications is an increase in cardiovascular disease. Cardiovascular disease is then treated by a primary care physician and is usually treated with additional medications. When you mix these when you mix these medications together, you increase different comorbidities, and that helps increase helps reduce the life expectancy. According to Psych Central, the top three medications that are being prescribed to adults today for the treatment of anxiety and depression are Lexapro, Wellbutrin, and Zoloft. Now, many of these medications have some common side effects, and some of them offer some severe side effects as well. Some of those are anywhere from sleepiness, joint pain, heartburn, hyperventilation, suicidal thoughts and ideation, anxiety, high blood pressure, and irregular heartbeat. So now that we've kind of discussed some of the things that are impacting adults and how those are also impacting children, let's talk about the long-term health issues that are being created by these medicines in children. Now, according to Albert, one of the major concerns is that when they gained approval for these medications, they based it on short-term efficacy, which means that they basically took a small sample size and said, hey, look, we're doing this with it, and they got approval without knowing long-term results of what would happen with these medications. There has to be there has to be an urge by us as society to resist the insurance companies to resist profits over safety and efficacy. One reason these drugs garnered quick approval for children was an increased revenue for the manufacturers of the drugs. There have been many factors that have led to the increase in the use of these medications, and according to Smith, antidepressants are being prescribed by primary care physicians today, which they don't have a treatment plan. They are just basically getting the medication from the primary care physician. According to Paul and Potter, mental health treatment has also been stagnant over the last 50 years, and there have been no significant breakthroughs. So that's causing issues as well. That's why they're leaning harder on the medication, because it's easier to treat with medication than it is to find different breakthroughs that haven't happened over the 50 years. And according to AIR, there needs to be transparency regarding the harmful side effects of these medications. And when discussing these medications with parents, it is important that the parents know what the side effects truly are, that they understand what the safety concerns can be, and what the impact of these severe side effects could be. According to Psych Central, the three most popular ADH drugs, Concerta, Vyvanse, and Adderall, had a combined revenue in 2020 of $8.6 billion. These medications are Schedule II narcotics, similar to those things, cocaine, methamphetamine, heroin, same type of drug structure. These drugs come with additional warning labels regarding how highly addictive they are in nature and the possibility of developing a substance use disorder and becoming addicted to the drugs. Now, some of the common side effects with these drugs, common and severe, are headaches, decreased appetite, nausea, fast pounding or irregular heartbeat, chest pain, and even seizures. So now we can kind of see that the associated risk that we have with our kids with ADH medications and the antidepressants and anxiety medications, I'm going to propose that the FDA places a moratorium on all prescriptions of medications for children to treat mental illness and emotional issues until they can set a standard of safety, efficacy, and ethical use for these children that meets the FDA's standard. Through my research, I've discovered multiple ways to address these concerns surrounding medications. Now, according to AIR, one way to combat this would be create a database that all physicians could use, primary care physicians as well, that shows how mixing of drugs, safety, and regarding the efficacy, safety, and what are the adverse long-term and short-term effects of these medications prescribed to children. Also, according to Albert, there needs to be a focus on addressing the shortage of therapists and counselors to shift from pharmacology treatment back to a psychological treatment of patients, where they actually engage with a therapist or a counselor the necessary treatment instead of depending on drugs. Albert states that these Schedule 2 ADHD, Schedule 2 narcotics, ADHD medications must have additional research to determine what is their true long-term and short-term impacts on a human brain that's still in development. We have many kids out there taking these medications and their brains are not fully developed. Are we damaging the brains permanently with our use of these drugs? And according to Ivanov, this additional research needs to also investigate how biologically these medications are mixing with children's brains and bodies and how they're impacting their growth and development. Being the promotion of a holistic approach, getting back to the holistic approach where we use mindfulness, breath work, and other types of avenues to relieve the stress and anxiety these children are undertaking. So, what this research clearly shows is that the use of psychotropic medications poses significant risk of harm or even death to children and adolescents. Further research is needed so we can determine what the true efficacy is with these medications. Are they truly safe for consumption by children? And they need to meet an ethical standard through approval by the FDA. So, in conclusion, my presentation today was to aim to highlight the dangers that occur when using psychotropic medications in the treatment of mental health and emotional illnesses in children and adolescents. I have demonstrated how these medications pose significant risk to adults as well as children. There is a need for appropriate testing to determine if these medications are safe and meet high standards set by the FDA. The experts provided the evidence. One more premature death or a new addiction is one too many. We have heard the data and we are seeing the consequences of inaction every single day. It's now time to take action to ensure that the safe and effective medications are available for everyone, including our children. Thank you for your time.